Hi, I'm Dr. Rashmi Shetty, dermatologist. Today we shall talk about PCOS or PCOD, however you have known it as. But we'll talk about more about what it does to your skin and hair in particular. Please do subscribe and share and like. Be beautiful. It's nothing but polycystic ovary syndrome, which means to say you have so many things like hair issues, skin issues, bodily issues, pigmentation issues, acne, hair fall, hair growth, all of that along with little cysts in your ovary. Earlier it was called as PCOD because it was called as polycystic ovary disease. Later we realized it's not a disease, it's something which is leading or coming on because of lifestyle going wrong. So it's just a bunch of things put together, so we call them as a syndrome and not a disease anymore. I'll just tell you certain simple things how you recognize if you do have a PCOS from your skin and hair itself. There are a few signs which actually tell you that it's time you go to your doctor to get the diagnosis, if at all that is the one. One, you will see your skin darkening than what it was before. You will see the complexion going patchy, like the neck becomes dark, your cheek can become dark. You could have dark patches around your forehead, around your eyes. The skin might look a little more velvety and thick. That can happen. You could end up getting abnormal hair growth on the face, like a male pattern hair growth on the face. You could start having hair loss. So you may end up having really hair shedding or hair loss. You can even see a receding hairline at times when it gets too severe. You could start seeing acne, especially painful ones, which we call it cystic acne around your jawline. You might be eating a normal diet, leading a normal lifestyle, but now you're wondering, why am I not losing weight? Instead, I'm gaining weight. So then there is something more that you may have to look at. Very, very often I get patients when I say, oh, maybe you have PCOS and we need to treat you. They end up telling me, but my periods are normal. Periods are not, or your monthly cycles being regular or irregular is not the only measuring way for your PCOS. They could be completely normal and you could still have PCOS. So please don't get carried away and think, as long as my periods is all right, the rest of the signs, I don't know what it is for and I don't have PCOS. No. So please talk to your doctor and let her decide and then let her take you from there. One thing that you need to understand is this whole cause of PCOS is not yet known, right? But we all attribute it to lifestyle and lifestyle changes. That is why you see everyone having PCOS now, but you see 10, 20 years earlier, it was a rare thing. But today, everybody seems to have it. Why? That's because of the lifestyle. So one, of course, is sedentary lifestyle, and two is the eating habits. Basically, you end up putting on weight around your girth or around your midriff. That will translate it to something called PCOS or insulin resistance. So if you do have PCOS, then things what you should not eat is something you should really, really keep in mind. Anything that tastes sweet. Sugar, honey, jaggery, sugar replacement, colas, ice creams, chocolates, biscuits. Yes, the list is endless. So any of those, including sugary fruit juice, none of that to be consumed. What you could eat instead is a whole fruit. They are the best natural source of sugar, but again, eat them, don't drink them, okay? So that's something that you can do. And when it comes to dairy, I don't want you to do any milk, especially skimmed milk. Whole milk is still okay. So skimmed milk, so that's because it's very inflammatory, that's it. And then if you really want to have some whitener in your coffee or tea, you could use almond milk, for example, yeah? Get exercise, like brushing your teeth. So make sure you start working out. That's really, really important. Cardio really works a lot better than heavy weights. So start off with cardio so that causes mobility of the body and tissue, which is important for you. One of the skin symptoms is acne and the other is pigmentation, like I said. So for these two things, make sure you don't rub and scrub your skin because it's not dirt, it's pigmentation due to the insulin resistance. So let the treatment take its course, but along with it, you could use skin lightening ingredients like a vitamin C cream, azelaic acid cream, kojic acid cream. These can really, really help. Ingredients like benzoyl peroxide, azelaic acid, niacinamide, all depending on what kind of skin type and what kind of acne you have. At your doctor's clinic, you can start off with peels, there are lasers, basically everything towards getting your infection down and inflammation down. The rest is taken care of the internal medicines which now recorrect your hormone and rebalance your hormone. There's excess hair on the face, right? So once you start correcting your hormones and they're somewhere coming towards a good balance is when you start your laser hair reduction. So that's something that you can start at that point. For your hair, change into healthy hair habits, which means to say, wash your hair regularly, keep the scalp clean. The nourishment from the food that you get is very important. You could do in the interim a few things that can keep your hair more stimulated, more healthy. Simply things like PRP, mesotherapy, maybe lasers that stimulate your hair, maybe a progenitor treatment. Any of this basically to keep the hair and the hair follicle healthy, stimulated. You can end up taking certain supplements which also correct PCOS, like evening primrose oil, vitamin E, flaxseed oil, your antioxidants. Vitamin D could be another very important contributing factor. So please do let me know if you like the information, if that was useful to you, and if you do have more questions, make sure that you write it on the comment section. Thank you and take care, and don't worry. This is easy. Just work on it and you shall be gone. As always, don't forget to like, subscribe and share.